we will be discussing about the examination of cardiovascular system. First we will start with general findings of cardiovascular diseases and then we will go to specific examination. Okay? So the first point is we have to see for the build of patient, see whether the patient is obese or not. If he is obese, probably he can have a cardiovascular disease. So this patient does not seem obese. इनमें एब्डोमिनल ओबेसिटी जो है एब्सेंट है, तो पॉसिबल है कि इनमें कोई कार्डियोवैस्कुलर डिसीज ना हो. सो फर्स्ट सी फॉर द बिल्ड. देन द सेकेंड पॉइंट वी हैव टू सी फॉर प्रेजेंस ऑफ साइनोसिस. सो वी हैव टू सी फॉर साइनोसिस ऑन द लिप्स, वी हैव टू सी फॉर साइनोसिस ऑन द नेल्स, साइनोसिस ऑन द palms. If it is absent, well and good, possibly he is not having any cardiovascular disease. Then we have to see for presence or absence of malar facies, MALAR facies, which is bluish discoloration present on the cheeks, nose. If it is present, it indicates the patient is having mitral stenosis. So in this patient, the central cyanosis is also absent as it is evident on the lips. Peripheral cyanosis is also absent as it is evident on the extremities, and malar facies is also absent. Then come to the third point, we are going to see for presence or absence of yellowish pigmentation, which is called as xanthelasma. It is indicator of underlying dyslipidemia. When the cholesterol levels start to build up, the patient develops yellowish pigmentation. Commonly it is noticed on the medial canthus of the eyes. So that is also absent. So probably his cholesterol levels are also within normal range. Then next you have to see for the palms of the patient and see for any small hemorrhagic spots on the palms. If they are present, they are called as Janeway lesions, which indicates infective endocarditis. Then see for any nodules and red colored inflammatory nodules which are painful and which are present on the palms of finger. Examine it on both the hands, it is absent. So this means that patient is not having Osler's node. If the nodes are present, they are Osler's node, they indicate infective endocarditis. Then see the nails and see for splinter hemorrhage, that means small hemorrhagic spots on the nail plate. So splinter hemorrhages are also absent, that means infective endocarditis is not there. Then examine the temperature of the extremities and see whether they are warm or cold and clammy. If the patient is having fever, it is infective endocarditis. We are going to see for the fever on both the extremities, superior and inferior, as well as on the forehead. So here the fever is also absent and patient's skin is also warm, it is not cold and clammy, right? So coming to the next sign of cardiovascular disease, that is C for bipedal edema. So bipedal edema we are going to examine on the shin, as well as we are going to examine on the malleoli. So what we are going to do is we are going to press for a period of 3 to 5 seconds and then we are going to release it and see for any depression on the part. If the depression is present, it is pitting edema positive. Okay? Pitting type of edema indicates that the patient is developing some cardiovascular diseases like in the form of cardiac failure. Then go to the next sign of cardiovascular disease and see for capillary refill. Capillary refill, to assess capillary refill, what we are going to do is we are going to press the nail plate for a period of 3 seconds and then we are going to release it. The pink color will reappear within a period of 2 seconds. This we can do on the nail plate or we can also do it on the pulp of finger. So if you want, you can do on yourself. Press it for a period of 3 seconds and then release it and you will notice that pink color reappears within 2 seconds. Okay? So this is normal capillary refill. If the capillary refill is delayed, it indicates that the patient's peripheral circulation is poor or the patient is developing some cardiogenic shock. So see for the capillary refill for the diagnosis of peripheral circulation and development of cardiogenic shock. Then next we are going to see for the dilated tortuous blood vessels on the neck region and on the chest region as well. So if they are present on the neck region and chest region as well as on the shoulders, if they are present, it indicates either the superior vena cava is getting compressed externally or it is blocked from inside, it is obstructed. So there are no dilated tortuous vessels on the chest wall and on the shoulders, that means the compression is ruled out. So now we are going to see for the jugular venous pressure. For jugular venous pressure, what we do is we elevate the head end by 45 degrees. We ask the patient to slightly turn the neck to one side. Now we can see this vein which is going upwards, right? This one, ये यहाँ पे दिख रहा है. Okay. What we are going to do is we are going to place the pen like this horizontally to the most prominent part of jugular vein, and then at a sternal angle कैसे देखेंगे? What we will do is we will place a finger at the sternal notch and we will move downwards, and here we get a prominent part. This is called as sternal angle. At this portion, the manubrium sternum gets attached with the body of sternum. This sternal angle is a very important surgical landmark because the second rib is getting attached at this portion. There is presence of bifurcation of trachea just below the sternal angle, and the arch of aorta is giving 3 branches just below the sternal angle. So this is important surgical या anatomical landmark. So what we do is place the pen horizontally at the prominent part of the jugular vein, and at the sternal angle we are going to place the scale, the zero pointing downwards, and then measure at how many centimeters the pen is touching to the scale. If it is more than 4 centimeters, it indicates that the patient's jugular venous pressure is increasing, and this indicates that the patient's right atrial pressure is increasing. Okay. Then the next thing that we are going to see is for presence or absence of acanthosis nigricans. Acanthosis nigricans is presence of blackish discoloration on the neck region and below the eyes. If it is present, it indicates that the patient's cholesterol levels are rising. Okay. Now, out of these findings, the more signs positive, that means there is a more chance of having underlying cardiovascular disease. If we want, we can see for tobacco staining marks in between the fingers, which are commonly seen in the smokers. Tobacco stain marks on the fingers. If he is tobacco chewer, you can get the line on the palm, sometimes the tobacco marks on the palm and on the lips. So tobacco staining is also important risk factor for the cardiovascular diseases. So the more the positive signs, the more is the chance of underlying cardiovascular disease. If I am getting some positive signs, then what I have to do is I have to confirm the hemoglobin levels. I have to rule out the anemia. Because if this patient is having a cardiovascular disease and he is also having anemia, then anemia is a very strong exacerbating factor for a cardiovascular diseases. Whenever a patient is having a past history of cardiovascular disease, remember, maintain his hemoglobin levels within normal range. If the hemoglobin level drops, the underlying cardiovascular disease is going to get aggravated. Okay? So see for anemia, you can cross check the color of palms of patient with your own color of palms. Here I can see that he is pale, he is anemic. I can cross check anemia by examining the conjunctiva. Okay. जबान बाहर निकालिए. हाँ, ठीक है. So the pallor is not evident in the eyes. Pallor is not evident on the tongue. It is not evident on the lips. It is just evident on the palms. Okay, so it is inconclusive sign of anemia. Okay. Then next what we are going to do is we are going to see for any scar marks which was absent on the thoracic wall. Then the next point was the dilated vessels, they were also absent. Last point we have to inspect is apex beat. So apex beat, it is present on the left side mid-clavicular line. So again, start at the sternal notch, go to the sternal angle. This is sternal angle, that means it is second intercostal. This is the second rib attached over here. This is second intercostal space, third intercostal space, fourth intercostal space, and fifth intercostal space. So fifth intercostal space, left side mid-clavicular line. This is the position for apex beat, and palpate the apex beat over here. Okay, if the apex beat is shifted from the fifth intercostal space down into the sixth or seventh intercostal space, it indicates cardiac enlargement. If it is shifted from mid-clavicular line towards the mid-axillary line, it also indicates cardiac enlargement. Okay, so see for the apex beat, palpate it. Here I can palpate it very well. Once you have palpated the apex beat, then the next point is palpate the pulse. We can palpate carotid artery, radial artery, or femoral artery. I can palpate radial artery bilaterally. See for rate, rhythm, volume and character. So calculate the pulse entirely for 1 minute. His pulse is symmetrical because on both the hands same volume, same rhythm is there. So I can calculate the rate now. His pulse rate is 76, the pulse is full, bounding, the rhythm is normal, sinus rhythm is present, and radial symmetry is there. Now I am going to see for radiofemoral symmetry. Radiofemoral symmetry is also present. And if I want, I can check for the carotid pulse. This is also symmetrical. Okay? As a beginner, always palpate two different arteries, radial, femoral, radial, carotid, at least two radial, and then give your conclusion. So my conclusion is pulse rate 76, rhythm, sinus, character, it is full, bounding and symmetry. There is no asymmetry present between the radial, between both the radial and between radial and femoral. So the conclusion is, by examination of the pulse, what I am going to tell is his pulse rate is low, but it is full volume, which probably indicates that this patient is having a past history of hypertension. Okay, so let us ask him. તમને બ્લડ પ્રેશરની કોઈ દવાઓ ચાલુ છે? નથી, બિલકુલ બી નથી. આજે ચેક કરાયું છે બીપી? ચાલુ હતી, બંધ છે અત્યારે?
એટલે અત્યારે શું છે, કાલે ગાડીમાં પણ છે, મારે ગોળી પતી ગઈ. સરકારી દવાખાનું દર મહિનાની આવે છે બીપીની, દિવસની એક લેવાની, એટલે ગોળીઓ રહી ગઈ છે.
ઠીક છે, ઓકે, રાઈટ.